Hi, I'm Riley.
And I'm Ari, and today we will be talking about neurocognitive disorders, which are disorders that affect memory and are often a result of aging. These disorders include, but are not limited to, delirium, amnesia, dementia, Alzheimer's, Parkinson's disease, PTSD, and traumatic brain injuries. These disorders often begin with delirium or a state of confusion and are followed by changes in the individual. This video will specifically focus on dementia and Alzheimer's. Both of these disorders occur in old age and are known to cause different stages of memory loss.
Dementia is a larger umbrella relating to various disorders that all deal with memory loss and mental impairment. Alzheimer's just happens to be the most common. Researchers believe approximately 10% of people 65 years or older and 45% of those 85 or older have Alzheimer's, with its prevalence doubling every half decade and expecting to triple by 2050. With these statistics rapidly growing, individuals ranging from caregivers to nurses to general practitioners are looking into treatments to, if not cure, manage this disease. One of the most helpful articles we found lent us information regarding the treatment of Alzheimer's with pharmaceuticals. Scientists were targeting different transmitters in neurons to stop symptoms and rid the person of the disease completely. Treatments were failing due to their inability to practice hypotheses on anyone other than those in clinical trials or those who had donated their bodies to medicine for post-mortem research. Researchers are especially behind because, unlike other medications, we can't use animals to test the effects of these medications since we don't know if they suffer from Alzheimer's or any other form of dementia. All treatment involving medications should also be combined with non-pharmacological interventions and preventative measures aimed at increasing caregivers' competence to deal with the individual. In addition to medical consultations, treatment plans should also include physical therapy, mental stimulation, and nutrition counseling as well.
Another form of treatment that we looked at involves non-pharmacological treatment or treatment without medication. Oftentimes, patients with neurocognitive disorders display some behavioral and psychiatric symptoms of the disorder. These can include irritability, forgetfulness, and confusion. Most of the time, doctors want to treat these symptoms with a medication of some sort to subdue the patient. An article by Amber V. Stadler and Diane Nunez discusses the reason these symptoms are normally treated with medication is that there is a lack of education about other treatment options and low staffed resident ratios within facilities. This article is a meta-analysis study of 10 different studies that span a 5-year time period. A positive link between non-pharmacological therapy and the reduction of symptoms was shown. By working with caregivers and educating them, these behavioral issues could be reduced greatly.
We have a brief video to give you an idea of the severity of certain cases and why it's so important we continue searching for it.
Yes. Of course. Who's us? Why did you phone me, darling? I don't know you. Who are you? Am I supposed to know you? No. No! No!
Dementia and Alzheimer's are conditions that we are learning more about on a daily basis with genetic testing and other medical advances. We can plan ahead and use intervention methods and turn them into preventative health care. Alzheimer's and dementia affects everyone's life in one way or another, so by knowing this information, we are able to help others as well as ourselves. Oftentimes, it is thought that there is not much that can be done for these patients, but this isn't true. Although right now there is no cure for these neurocognitive disorders, there are ways to manage symptoms, and by knowing them, we can help patients who otherwise may not be able to help themselves.
That's all we have for today. Thanks for tuning in.